Today, we're going to explore the ins and outs of osteoporosis, symptoms, causes, and risk factors of osteoporosis, and most importantly, the steps you can take to avoid it. By the end of this video, you'll know how to safeguard your bones so you can live without fear of fractures. Hit that like button and let's get into it. Osteoporosis is essentially a bone disease. At its core, osteoporosis happens when your bone density decreases over time, leading to a deterioration of bone structure. This makes your bones weak, fragile, and prone to fractures. Now, that might sound simple, but the reality is much more complex. So why should you care? Because your bones, your skeletal foundation, are what hold you up every single day. And osteoporosis, if left unchecked, can completely disrupt your life. It is amazing how your bones function. Osteoblasts and osteoclasts are the two main cell types in your body that regulate the health of your bones. The good guys are now osteoblasts. They are in charge of producing new bone. Conversely, osteoclasts cause bone resorption, which is the breakdown of bone. A young adult in good health exhibits a balance between these two processes. Your skeleton is maintained strong and robust by the continuous dismantling and rebuilding of your bones, which functions as an ongoing construction project. This is where things begin to shift, though. You reach what is referred to as peak bone mass in your 20s. Your bones are at their strongest at this time. However, the ratio of osteoblasts to osteoclasts changes with age, particularly in your 40s and 50s. Your bone density starts to decline as the osteoclasts gain the upper hand gradually but steadily. At that point, you start to experience osteopenia, which is basically the early stage of osteoporosis. Osteopenia might be thought of as a warning indicator, similar to unusual noises coming from your car. Although it is not a total collapse just yet, it is a warning sign. Have you ever wondered what happens when the years start adding up, and all of a sudden you're 50, 60, or older, and realize that after giving so much to others, you've forgotten to take care of the one person who matters the most, yourself? Trust me, if this thought hasn't crossed your mind yet, it will. And let me tell you, there will come a time when you'll ask yourself, what have I really done for my own health, my own body? At that moment, you'll realize the world keeps moving forward, and if you've neglected your body, it won't be there to support you when you need it the most. Now, I'm not here to lecture you, I'm here to help you. To guide you in building your own strength, your own body, and your own mind so that till the very last day, you won't be dependent on anyone. No one wants to be in a position where they have to ask for help, to beg for it even. We all know, deep down, that people are often too busy with their own lives. You've spent your whole life caring for everyone else. But when your turn comes, who's going to take care of you? No one unless you start today by caring for yourself. Now let us discuss the actual causes that can hasten the deterioration of your bones. And yes, this can affect you sooner than you think. Menopause is one of the main reasons, particularly for women. Although the menopause is a normal part of life, there is a hidden cost associated with it, a dramatic decrease in estrogen levels. Why is estrogen crucial for healthy bones? Consider it the body's defense system for your bones. The regulation of the ratio of bone production to bone resorption is largely dependent on estrogen. It basically reduces the rate at which bone is lost. Thus, that barrier vanishes when estrogen levels drop, and bone deterioration starts to exceed bone growth. It is because of this shift that women have a significantly higher chance of getting osteoporosis, particularly postmenopausal women. It is as though a switch is flicked, leaving your bones more susceptible than they have ever been. The fact is, however, that menopause is not the sole risk factor. Your everyday routines, the things you do without even thinking about them, can expedite this process considerably. Let's start with physical activity, or rather, the lack of it. Living a sedentary lifestyle, which involves little movement or weight-bearing activities, can significantly hasten the loss of bone density. Long periods of sitting, whether working at a desk or just relaxing in front of the TV, do not place any stress on your bones. The secret is this: bones require stress. Not the kind that comes from work or life, but physical stress. Your bones strengthen in response to pressure when you walk, run, lift weights, or simply stand for extended periods of time. It's like they adapt to the difficulties, but they become weaker if you do not challenge them. Thus, a key warning flag for bone health is a predominantly sedentary lifestyle. And let us not forget about diet. Your bones are continually repairing and require the proper resources to do so, primarily calcium, vitamin D, and vitamin 2. Calcium is a bone-building mineral, and vitamin D helps your body absorb it efficiently. Without these necessary nutrients, your bones will not be able to maintain their strength. It's like attempting to construct a home without bricks. But that is not all. Did you realize that family history has an impact too? Yes. If you have a family history of osteoporosis, you are more likely to develop it. Consider it an unwanted genetic inheritance. Your genes determine how strong your bones are, how well your body absorbs calcium, and even whether you are prone to rapid bone loss. So, if your mother, father, or grandparents experienced osteoporosis, you should be more aware of your bone health from an early age. While we're on the topic of risk factors, let's discuss body shape. You may not have realized it, but your body mass index, BMI, has a substantial impact on bone health. People with a lower BMI are more likely to develop osteoporosis. Why? It's partly because thinner people have less bone mass to begin with, so when bone loss occurs, there's less to lose before it becomes a major problem. This is especially concerning for young ladies and athletes who are extremely slender or underweight. In fact, some young athletes, especially those in sports that emphasize a lean physique like gymnastics or ballet, are at risk of developing low bone density early in life due to a combination of factors, including intense physical activity without adequate nutrition. But wait, there's more. Other lifestyle choices can also have a negative impact on bone health. Smoking, for example, is known to reduce bone density. Nicotine and other chemicals in cigarettes reduce the body's ability to absorb calcium, weakening bones over time. So, if you smoke, your bones will suffer the price. Then there is alcohol. Drinking too much alcohol has been linked to decreased bone growth and an increased risk of fractures. It's not just severe, continuous drinking, even moderate alcohol usage can gradually erode bone strength. So, if you're drinking a glass or two every night, it may be time to consider reducing back for the benefit of your bones. Certain drugs can also speed up bone loss. Consider glucocorticoids, for example. These medications are frequently recommended to treat inflammatory disorders such as asthma, but they have substantial side effects. Long-term glucocorticoid usage can disrupt calcium absorption in the intestines by inhibiting vitamin D, resulting in fast bone density loss. Not only have glucocorticoids been related to bone loss, but so have heparin, a blood thinner, and L-thyroxine, which is used to treat thyroid disorders. If you are taking any of these medications, consult your doctor about how they may impact your bones and what you may do to mitigate the effects. Now, let's not forget about physical inactivity for individuals who may be in unusual situations like astronauts. That's true. Even astronauts in orbit must care about their bone health. In a zero-gravity environment, there is no tension on the bones, hence bone density rapidly declines. Because of the lack of gravity, they do not exert as much force on their musculoskeletal system as they would on Earth, resulting in less bone deposition and more resorption. While most of us are unlikely to be floating in space anytime soon, it serves as a reminder of the need of regular physical activity in preserving strong bones. In addition to these lifestyle variables, several medical diseases can raise the risk of osteoporosis. Turner syndrome, hyperprolactinemia, Klinefelter syndrome, Cushing syndrome, and diabetes mellitus are all associated with inadequate bone density. These disorders can have an impact on the body's hormone levels, metabolism, and calcium processing abilities, all of which are important for bone health. If you have any of these disorders, it is even more vital to monitor your bone health. Knowing these risk factors allows you to take steps to minimize or even prevent bone loss before it becomes a serious problem. So, what are your next steps? Whether it's being more active, improving your nutrition, or speaking with your doctor about your risk factors, remember that it's never too early or too late to begin caring for your bones. So, what does osteoporosis look like? You might be surprised to learn that in many circumstances, it is silent. That's right, most people are unaware they have osteoporosis until they get a fracture. However, there are a few warning indications. One typical sign is spinal discomfort or chronic back pain. This can occur when your vertebrae, the bones in your spine, weaken and compress. Over time, this might result in kyphosis, a hunched back position that many elderly people have. Of course, the most serious result is fractures, particularly hip, wrist, and spine fractures, which can significantly impair your quality of life. Now you're probably wondering how you can tell whether you have osteoporosis. The primary diagnostic instrument is known as a DEXA scan, and this is where things get a little technical, but bear with me. A DEXA scan assesses your bone density by comparing it to that of others. It provides two significant scores, T-score and Z-score. The T-score compares your bone density to that of a healthy young adult, whereas the Z-score compares it to those your own age. A T-score of less than or equal to 2.5 indicates osteoporosis. Similarly, a Z-score of less than 2.0 puts you in risk. The good news is that you may manage and even prevent osteoporosis by taking the proper precautions. If you are over 65 or a postmenopausal woman, you should take nutrient supplements such as vitamin D, vitamin K, and calcium. Vitamin D helps your body absorb calcium, which is necessary for bone health. However, much calcium can harm your heart, arteries, and kidneys. Getting the appropriate mix of these nutrients can greatly lower your risk of osteoporosis. Now, for those who are diagnosed with osteoporosis, there are medications like bisphosphonates and ibandronate. However, there are numerous negative effects to these medications. So begin taking these medications as directed by your healthcare practitioner. Now you might be wondering, is there anything else I can do? Yes, there is. In addition to medication, hormone replacement therapy (HRT) is another option, especially for women. HRT combines estrogen and progesterone, which can help prevent further bone loss. The reason both hormones are administered together is to reduce the chance of endometrial cancer, which is a possible side effect of estrogen alone. Let's get into some real-life scenarios. Consider a 67-year-old woman who is concerned about osteoporosis. She went through menopause more than 10 years ago, has no fractures, and has never smoked. You would believe she's in the clear, but a DEXA scan reveals a Z-score of 1.6 and a T-score of 0.9. These scores tell us that she doesn't have osteoporosis yet, but she's heading in that direction. So what do we do? And can we actually reverse osteoporosis without relying on medication and its side effects? The answer might surprise you. To discover how, watch this video.